My name is Mark Karanofsky. These are the places where I work. This is the Herzl Clinic. You can notice the cross at the top of the building. It is part of the Jewish General Hospital. It's the little building right next door. And this used to be my office, but then they gave me a bigger room. I work at Jewish Eldercare. I am one of the doctors here on Hope 4A. I've been here since I've been back in Montreal, so I'm close to 4 years here. I do work in the main hospital regularly. I do acute care. And I work for McGill also. I teach a lot for the undergrads, for the medical students. And we all do a lot of stuff together. Newspapers. We all read them every day. I make it a point to read the Gazette every day because I know if I don't, by 9 o'clock, somebody will tell me what I forgot to miss. I typically look for medical information from a little bit different types of journals. But a lot of my patients get their medical information from there. And I always look at it as a double-edged sword because I think the role of the newspapers are to keep people informed and doctors on their toes a little bit too. But it also gives the opportunity for the patients to bring new things that they can bring into question to doctors. The downside often is, though, that they don't have any filter in that does the information in the article really apply to you? And is this a sensational new treatment that has been tested on 12 people in the middle of some nowhere place? And does it really apply to Canadian population? And some of it is true. Some of it probably is a little cavalier for my liking. But it has a lot of issues. So what we're going to do today is, and then people bring these articles into the office all the time. I get clippings from the Gazette and from various other papers around the world. We're going to cover a few topics that have been in the newspapers over the past couple of months. Some of them are from the Gazette, some of them are from the web, some of them are from all the news places that people have brought them in to see me. And we'll talk about some of the things that I agree with, some of the things I disagree with, but just a general topics overview as well. So vitamins. When I was a kid, my mother made me take those. Some people might take these, but then this day and age, it's not unusual that patients will show up with a bag full of different colored pills and say, I take 1 of those, 3 of those, and 6 of these on Sunday. It varies which ones, and people often ask, are vitamins good for your health? And it's a very good question. So this was an article that was put out by Reuters that said, exercise and vitamin D tied to fewer falls. And so it brings up a good point, because multivitamins have actually never been shown to be absolutely good for your health. There's no trial where they gave 10,000 people vitamins, 10,000 people sugar pills and said, okay, who does better? A lot of the theory of these multivitamins is a lot of conjecture and a lot of thoughts. Vitamin D, though, there is some evidence mounting more and more that it is actually good for your health. So vitamins can be good for you. Which vitamin is missing from the following picture? Anybody know what this is? Rickets. I show this to medical students. They have no clue what it is. But rickets. So what is missing in rickets? Vitamin D. Vitamin C is scurvy. So scurvy is what they had when they came over on the ships and they needed to have it. Vitamin D this is D. D. And this is in kids. This is in a child. You can get rickets. In adults, it's called osteomalacia. And it's severe vitamin D deficiency. Not very common in adults, to be perfectly honest. Vitamin D looks like this. You must have seen it all. Not really. But where do we get it from? Typically, most people will get it from sunlight, which we have plentiful amounts of in Canada. And typically, your skin will convert the sunlight, and it'll make your skin make vitamin D. But then it has to go through your liver and your kidney to actually become active. So people who have problems with their liver or their kidney, while they might get enough sunlight, might not actually have enough vitamin D. And if we live in Canada, we may not get enough vitamin D in general because we don't stay outside in the sun enough. This brings me to one of my rules. And I tell patients, and some of my patients in this room might agree with me if I've told them this. I usually joke about it. But I tell people when they turn 60, there's a rule for doctors and a rule for patients. The rule for doctors, don't kill your patients. Very simple. The rule for patients, I say, is this. You can go bungee jumping, you can go skydiving, you can go for a walk in the park. You can't fall and break your hip. And the reason why I say that is because a broken hip has such an impact on somebody's quality of life and their ability to do things that I like to avoid it as much as humanly possible. And so the question always comes up, what can I do to prevent breaking my hip? So, broken bones often happen because of osteoporosis. Brittle bones get more and more common as we get older, more prevalent in women than in men, but not exclusively in women either. And you can see here this bone, it looks quite porous. There's a lot of spaces. In osteoporosis, the bones get weak. The links that maintain it get thinner. So people get thinned bones. And there's a few medical treatments that can be used to increase the bone density and the bone quality, but that's for your doctor to prescribe. Vitamin D can be used to help build bone. You need vitamin D in order for bone to build, and if you don't have it, it doesn't grow.
How much do you need?
We'll come up to how much you need. By the way, if you ever have any questions, just stop me. I'm very happy to be stopped at any point. Falls. Vitamin D actually has been shown in the elderly to decrease the incidence of falling. And it's an interesting point. Why would that happen? They're not quite sure why it works, but vitamin D seems to decrease people feeling unsteady and falling. And if you don't fall, your likelihood of breaking your hip goes down as well. I put this in small letters, cancer. There have been studies that have looked at whether or not vitamin D prevents cancer. It's very loose, it's very soft. I would never give someone vitamin D to prevent cancer just like that. I like the no falling and no broken bones better. But there is some emerging evidence that it may contribute to prevention of cancer. So, does that mean we should all go outside and bake in the sun and get some? So, they've done some studies on how much vitamin D you need. And there actually is, it's fairly vague, but you need in kids, you need to bake the kid in a diaper only for about 30 minutes once a week in order to get enough vitamin D. We always tell parents under 6 months of age, don't do that. And so that doesn't work. Or you need to put 2 hours a week fully clothed with no hat on. And I generally don't tell my parents to put their kids without a hat on either outside. And so it's not infrequent that in this part of the world that we do get a little bit of vitamin D deficiency. And generally we advise all parents to give vitamin D either through the milk or through the formula to their kids. And now the question is how much to give to our adults. And about a year ago, the Canadian Osteoporosis Society upgraded their numbers of vitamin D. And typically the recommendation for after menopause or over 50 would be 800 to 2,000 units a day for vitamin D. And some people will even take it as 10,000 units once a week as a single dose. And this has become much more popular over the past few years. The other thing that happened last year was that they actually lowered the calcium level. There were reports of increased risk of heart disease, and so they actually lowered the amount of calcium they were recommending taking. So now, more my approach is to push the vitamin D as opposed to pushing the calcium in vitamin D. I try to make sure people have a little bit of calcium in their diet and maybe a little calcium supplement, but if I'm going to pick, I ask for vitamin D first. Yeah?
The vitamin D that an adult gets, if you're out in the sun and you're wearing sunscreen, does that change the interaction? So I'm not 100% sure. I think it does decrease it a little bit, but the sunscreen you should wear either way so you don't get cancer. It's kind of one of those double-edged swords. I don't think it has that much impact because the sun is stimulating the skin to produce the vitamin D. I'm not sure how much. I'm guessing it does a little bit, but I'm not sure. So we can stay out.
Stay out longer with sunscreen. Yes.
2 questions. What is the calcium limit per day?
Good. So the calcium limit now is 1,250 milligrams, including your diet. So it used to be everybody used to go on 500 milligram tablets 2 or 3 times a day, or the 650 milligrams twice a day. But if you actually follow the guidelines now, that means you can't drink any milk or eat broccoli or have anything with calcium in it at the same time, which is not really that feasible. So the question is can you if you take the 10,000 once a week, is it good enough to last you the whole week to help the calcium get absorbed? The easy answer is this. Vitamin D is one of your fat-soluble vitamins, which is an there's 4 vitamins that if you melted in water would dissolve in water, 4 of them that if you put them in fat would dissolve in fat. Really not that important in general, but the difference is when it dissolves in fat, it means it goes throughout your entire body, and your body actually stores it over time. And it'll store in any fat molecule that you have in your body, so that way, even though you're taking it once a week, your body will store it in its fat, and over the week will release it out through your body. Vitamin C, on the other hand, anything you don't use or need, you will urinate out in the next 24, 48 hours.
Is there an overdose of vitamin
Is there an overdose of vitamin D? Good question. They say that there can be overdoses. Dr. Hoffer at the Jewish is big on vitamins. He even thinks that you could do 50,000 units every day for certain populations without any danger. Would I ever recommend that? No, but his approach was that that doesn't even seem to be dangerous. But most people don't go above 10,000 per week. And usually the pharmacy will only give you, so that's 14,000 a week. So, but nobody, like in one dose, people won't take more than the 10,000. And typically the pharmacies will only dispense you 4 pills at a time of those if you go for them. So you're not going to have 4 pills at your house anyway. So it's probably not unsafe. Yeah?
Is there a better time of the day to take vitamin D?
It depends on some of the other medications you may or may not take. Some things can affect absorption of vitamins and the such, so that would be the only thing. Otherwise, it shouldn't be a problem pretty much any time of the day. It's a fat-soluble vitamin, so if you eat something with fat, it might actually absorb a little bit easier. But for the most part, it doesn't really matter. Yeah?
Is there any relation between the calcium pills and calcium deposits in your body?
So that's what the fear is now with the calcium. The fear with the calcium was that if you take too much calcium, you can have more calcium go in your arteries, and that may or may not lead to heart disease. And so that was the fear, that we've been pushing calcium for so many years, and all of a sudden, 10 years later, we might find out that we have more heart attacks because of it. My gut tells me the impact is not going to be enormous in that you take a calcium pill, you're going to have a heart attack. I don't think it, or even 1 in 2, 1 in 3. It'll be on a population level that it would be noticed. So a few per 100,000. I mean, there was that whole incident with the hormone replacement therapy a few years ago where everybody started panicking about the risks. And I'm not saying that the risks weren't real, but the numbers that we were dealing with were really, really small. And the fear overwhelmed a lot of people instead of taking it one step at a time. And so the calcium may or may not, and that's what they're looking into more and more. But that's why they lowered the amount this year. Yeah.
What's the level of vitamin D for kids?
Into the recommendation?
Yes.
They actually say 400 units is what we recommend for the infants up until they're drinking enough milk to absorb it. Or in formula, it's actually fortified with vitamin D.
I mean, older because they're teenagers.
It's soft at best, but it's typically 400 to 800 is the recommendation dose for adults or for most people, and as you get older, more. So, where can you get vitamin D in your diet? Anybody have an idea? Milk. Is it found in milk? It's added, right? Okay.
Same with soy milk.
Same with soy milk. Yeah, and milks have been fortified with vitamin D for many, many years. Any other ideas? What other foods?
Vegetables?
Well, orange juice, it's also added. Chocolate, I have not heard that it's in chocolate, although that would be a good marketing strategy. They sell the calcium soft chews, they sell in chocolate. I usually try to taste the stuff that I don't worry about giving my patients that I could try. I've tried the calcium soft chews chocolate. It's not too bad. Actually, you can get it in fish or eggs, especially the fatty fish. But the amount is not high. You would actually have to eat a lot of this in order to get your vitamin D. Any idea how many glasses of milk you'd have to drink every day in order to get your vitamin D?
Even though it's fortified?
Even though it's fortified, how many glasses of milk would you need?
3?
I got to vote for 3, I got to vote for 10, 8. Well, it's actually closer to about 5, between 5 and 6 a day in order to do it. Or get your supplements. And that's why most people don't drink 5 or 6 glasses of milk every day. That's a lot of milk. Yes?
With geriatric patients
Yes.
taking a large number of drugs,
Right.
is there any problems with vitamin D reacting with other drugs?
For the most part, vitamin D is pretty benign. Sometimes some of the drugs will affect the absorption of the vitamin D on the other side. The nice part about the once-a-week treatment is you can try to time it away from everything else. And though the one thing that you have to be careful with sometimes is when you mix it with calcium, the calcium can interfere with some of the absorption. So for that, you should speak with your pharmacist to go over to make sure that it's not interacting with anything.